A wave of positive charge occurs when a stimulus from a neuron at the neuromuscular junction reaches the voltage-gated sodium channels on the cerebellum. The sodium voltage-gated channel open when there is an increase in positive charge. The voltage-gated sodium channels close due to the buildup of positive charge on the inside of the membrane. While this occurs, the voltage-gated sodium channels open because the channel opens when the inside of the membrane is at its maximum positive charge. Flowing out of the muscle cell rapidly are positively charged potassium ions, following their concentration gradient when this occurs. There will be a decrease in the level of positive charge which occurs in the cerebellum. The return of membrane resting levels of charge is called repolarization. When the cerebellum has been fully repolarized, the potassium channels close. The potassium and sodium pump uses ATP energy to restore the concentration gradient of both ions.
When an action potential reaches a neurotransmitter junction, it causes acetylcholine to be released into the synapse. This acetylcholine binds to the nitonic receptors concentrated on the motor end plate, a specialized area of muscle fiber.
The neuromuscular junction, a neurotransmitter called acetylcholine, is released. This chemical binds to receptors on the muscle fiber. Acetylcholine receptors are chemically gated ion channels, and when acetylcholine binds, they open, allowing influx of sodium ions into the muscle fiber. This stimulates the sarcolemma and generates another action potential that travels through tiny folds known as transverse tubules. The action potential reaches myofibrils within the muscle fiber. Surrounding the myofibrils are membranous sacs called the sarcoplasmic reticulum. The arrival of the action potential triggers the release of calcium ions stored in the sarcoplasmic reticulum. They diffuse into the muscle fiber, and the next phase of muscle contraction begins.
Homeostatic relationships mainly involved in ALS include both the central and peripheral nervous system, the muscular system, and the respiratory system. Once the nerves and nervous pathways in the body have been destroyed, it is impossible to send impulses to the specific muscle groups, preventing voluntary movement of that body part. The nerves in the pulmonary region are responsible for the body's respiration. Without providing the body with regular respiration, it prevents life-sustaining oxygen from effectively entering the body and ineffectively releasing the toxic carbon dioxide from within. The lungs, heart, and diaphragm all need to work together for optimum respiration.
Amyotrophic lateral sclerosis, ALS, often called Lou Gehrig's disease, is a degenerative disease of both the upper and lower motor neurons. As more and more motor neurons become affected, they are unable to send signals for movement to the muscles. Loss of voluntary muscle movement and coordination develop. Over time, muscle weakness and spasms develop.
Currently, there is no cure for ALS. However, riluzole is the only FDA-approved medication given to patients with ALS. This medication only increases the patient's lifespan by a few months. This is because ALS mainly affects the nervous system, and once nerves become destroyed, they are unable to be repaired naturally nor medically.